guys, welcome back to my channel. My name is Ruth. If you are new to this channel, welcome. In today's video, I will be sharing with you guys another new journey that I'm starting. And yes, just to motivate and encourage as usual. So I decided to sign on to a wound care course, certificate course that was offered through my job, and it was an opportunity that I saw and grabbed onto. But every opportunity comes with responsibility, obviously. Today we'll be going over this material, not a lot, just I'm just letting you guys see what it's like an overview of what it's going to be like for me for the next month and a half. Yes, so this course is an online course. It's like self-tutor for the online modules. They have video recordings and everything that you watch at your own pace, but you do have a deadline. And our deadline for in-person meeting will be May 16. That will be my first in-person practical for the course. So it is Wound Treatment Associate Participant Workbook. So that's the workbook that was sent to me. And like I said, this and the course and the certificate, they are all free. I think at the end of the program, if you like to purchase a pin, which is just $15, and just to support the association, you can. It's totally voluntary. You are not forced to do it or coerced to do it. But I think that's something I would do, at least to show my appreciation for knowledge imparted to me. I am planning to do it. So this is how the course works. You going to do this online course, which I will show you a little bit on my computer, but nothing in depth, because obviously this is something that this is their business. This is what other nurses will pay for if you're not going through your job or got some opportunity like I did to get certified as a wound care nurse. You will pay for it, which is still a good thing, because at the end of the day, that is another certification added on to your existing knowledge as a nurse. And they do pay you a little extra if you become a certified wound care nurse and are being used by your hospital. They will definitely give you a little increment, not a lot, but a little increment on your pay. At least that's what I heard. And I honestly really just loved wound care from the first time I saw those wound care specific nurses come through my clinical and took care of a patient that had a very huge wound on the abdomen. And those nurses, you have vacuum, like you learn it in school in books. It's different when you're doing it in person or so watching someone else do it in person. And I was just astonished by them. When I first started to think about what part of nursing I'll be interested in, those ladies, I'm telling you, they woo me over. Like sometimes when we have something going on, like even an assignment that asks you about what kind of nurse you want to be, I will always tell people I wanted to be a wound care nurse. And I had this instructor who said, she said it's a great thing to want to be a wound care nurse, but what she would suggest to me is going and doing a little bit of regular bedside nursing to get most of my skills down before diving into wound care. Because once you get into wound care, it's more specific just on wound you're going to be focused on, and you might lose your other skills that you had acquired from school. So being a new nurse, I took her advice and I was looking to something that would be more bedside, and I think it was a good decision I took to do that. So now being there and being offered this opportunity at my job to get the same thing that I always wanted to do. Is a blessing. I see as a big blessing, and I'm definitely grabbing onto it. You all know that I'm always coming on here crying that I'm busy with schoolwork, and now your girl has added another more schoolwork to her plate. Yo, who does that? But yes, I feel like opportunity comes sometimes once, and I don't want to have regrets. I don't want to tell myself that I should have taken up this opportunity and I didn't. So I applied for this and I got approved. I think it's about 3 of us on my unit that are going for this course, and I'm so excited. So once we are done with the theoretical, which is the modules and stuff, it has quizzes as well, and we're going to do those quizzes, but it doesn't guarantee that you are a wound care nurse. After you complete this course, at least the information we got, you're going to take a test. It's more like a state test, I think. You have to pass it. Then you need to make a minimum score of 70 overall, because you're going to do different tests, like category of tests. You have to do the theoretical as well, like the online testing, and you have to do your practical skills checkup and all of that. Your overall score has to be 70 to qualify for that certificate. So it's not easy ball game, something that's just going to be thrown free at you. You have to definitely work for it, like work really hard for it. And yes, I am getting started on it. I already signed on into the course, and like I said, I will show you a very brief outlook of it, because this is definitely their business. I'm not here to give out information that does not belong to the general public. So I will just give you an overview. I'm logging on to my computer now. And I have already signed into the course. So I will just let you see. It says, welcome to WOCN, which stands for Wound, Ostomy, and Continence Nurses Society. So yes, once I get certified when I complete my program, this is the association I will be a part of. And these are things that they cover. They do wound, they do ostomy, they do continence, foot and nails, and just different things they offer. So when I come, here to my account, and on here you will see how to navigate it. It gives instructions on how to navigate the course, and I've already gone over it, so I'm pretty familiar with how to get to my course. I can come here to my course, and you see right here, welcome Ruth Tembe, and I already did my first lessons. It's complete, but I still have a lot more to do. So this is the first lesson that I completed. I need to complete all of these. Yes. And then I'll come to my final exam and evaluation. Each of them, as you open it, you see here it says requirement not met. So I have not done any of those yet. I need to get to it, because I have between now and May 16 to be done with it before I can qualify to go for in-person class. Yes, in-person lecture. I have the different topics that has been covered. Yes, so this is how far this is what I've done so far, and this is how far I can take you guys into the course. And like I said, for privacy reason, I'm not going to go any further because I'm not going to give out information that does not belong to the general public, because your girl does not want to have any problems. Okay, we are here to educate, entertain, and work safely. So that will be it for this video, and I thank you all so much for your support, for your love. I really appreciate you all so much, and thanks again. Please subscribe and comment and like my videos. Okay, thank you. Bye for now.